When it comes to the Tuskegee trial thing, I felt that the first right that was violated was definitely the one that they discussed in the Belmont report that came in 1979, and anyone that does human research needs to read it before they are allowed to continue with their research. But the first thing that is told in the Belmont report is respect for people. This means that the researchers need to tell their subjects exactly what is going to happen to them and have them form complete consent. This obviously did not happen in the Tuskegee trials because they hung up signs during the Great Depression, which is where this all took place, and where on the signs it said like you can get good blood for for African Americans, because back then African Americans were supposedly had bad blood, so this was gonna just clear, kind of like this was supposed to like just take care of it. For the second thing that is in the Belmont report is the beneficence. This means that researchers need to tell their test subjects all the possible effects that could happen and all the possible benefits that could happen. This for sure did not happen in the Tuskegee trials due to they were told that they were going to get infected with syphilis, and then when treatment came out, the penicillin, they were apparently on a list that made it impossible for them to get the penicillin shot. This was just like very unjust of like the researchers. The principle, and then the next one is the principle of justice. This means that researchers need to pick their group of people they want to test unfairly and randomly without consideration of any economic, social, and gender class. This did not happen at all in the Tuskegee trials because the people that were selected, which were on the poster that was posted was only wanting African Americans that apparently had bad blood. Another right that I feel that was violated is their trust on health professionals. Now that many African Americans know about the trials that went down in the study, most of them lost the trust of health professionals. They are thinking to themselves, just because I'm African American, does that mean I am going to receive less care than that of that white American in the room next to mine? Or they might think, is she racist? Will I get injected with something I didn't sign up for? This doesn't seem like that big of a deal to some people, but to those African Americans that are scared to seek treatment because of their ancestors' past can really put a burden on someone, and sometimes that will affect their mental health too. The next question was, what would happen to the research team if this happened in 2015? If Tuskegee trials ever repeat itself and the research team would not get away with it likely than they did like 60 years ago, this reason would not get away with this because liability is now in place for all healthcare professionals. If you are on or off the clock, you are responsible for what you do. This also applies for the risk management in the health workplace. Methods used to manage risk are part of the quality improvement or quality insurance, a program of practice performed by healthcare providers and practitioners to uphold the quality of patient care and to reduce liability and risk, which is on page 146 in the book.